Mandy, good morning.
Good morning.
Clank. Cheers to that. How you doing?
I am doing great.
I don't know if that's how you're supposed to sit that. That's crazy. We're excited, guys. Glad to be with y'all. So this is our series of our Do Some Good Mobile podcast. So everyone that's involved in the show in the magazine. So if you're watching this, here's the physical magazine. If you're listening, then you can find it on our website, themobilerundown.com. But the publication is out. We're excited, and we're giving everyone that's in the publication this year an opportunity to interview with us so we can learn more about their organization. So do you want to go ahead and hint and tell them who we have on today?
Yeah, and I just want to say one thing about that. So it's really cool to have all the information in print. We love print. We also have this digital on our website as well. But being able to interview someone that is part of the organization brings it to life. You get to see a person behind the scenes.
Agreed.
And so today, it's not really medical advice. It is like...
Give like a hint, but don't tell them.
Well, I think that was my hint.
Okay.
No, I don't know.
All right, we'll be right back. All right, I know I cut your hint off. I apologize.
You did, yes. It is, I think it's Mobile's best kept secret on how to get healthcare if you are in a financial bind, I think is the best way to put it. And so today we have on Kim Garrett from Victory Health. And I am so excited to see her face, bring her on, and chat about what all they are doing in Mobile.
Let's bring her on. Let's do it. Miss Kim, good morning.
Good morning. Good morning.
It's good to see you.
Good to see y'all. And I am not a doctor. I can give no medical advice.
Yeah. So when I said that, I was like, that is
disclaimer right up front. Yeah. No, that's good.
I can apply a Band-Aid and that's it.
Mandy got a little excited there, and she kind of, she went over the top.
Love that. We're so excited.
Tell us who you are, and so I like to kind of say like. If you're walking up to a stranger on the street and you're trying to describe what you guys do and what your organization's about, maybe give us that overview.
Perfect. Well, Victory is a nonprofit multi-specialty clinic. We're in our 20th year, and we provide healthcare for adults without health insurance. So children, talk about children real quick. Children have access to healthcare. They have all kids, Blue Cross Blue Shield. But what was identified for Victory in the beginning was this group of adults. They were hardworking, in industries like restaurant and retail, construction, tourism, small business, entrepreneurs, just like kind of a whole array of people who were working. But they didn't have access to healthcare. And so they were delaying their care. They were not able to see the doctor. They were utilizing the hospital ER for their primary care. And they just weren't well. So we provide full access to healthcare for those adults with partners, over 200 partners who do everything from dermatology to cardiology to surgery to GYN to mental health counseling. And it's affordable, it's accessible, and that's what we do. And we've grown to serve the entire Gulf Coast, which is amazing.
That's awesome.
Yeah, and so I know that you were with Victory Health previously in a former life, and now you are back at Victory Health as executive director. Is that correct?
So director. So Dr. Lightfoot still holds the executive director role. But, it's just such a great team, and there's a lot of things that go between because he's in the exam room seeing patients. So I help out in some ED roles that I can, but still the director, which is a great opportunity for me to learn all the operations. So I was the development director, so the fundraising, the marketing, the events, and now it's more clinical operations and strategic partnerships and, opportunities to continue moving the clinic forward. So it's been a great learning opportunity, especially going through a pandemic. So
yes, as every nonprofit we know. So that actually brings me to my next question. COVID was hard for everyone, especially nonprofits, because the majority of where you get your funds is fundraiser, donor-based events and dinners and things like that. And so I know that you guys had to postpone some things, but then you were able to have your big event this past May, correct?
Mhm. Yes.
So tell us
it
a little bit about
was
that, because I know that's a huge thing for Victory.
It is. It really is our only fundraising event that we host for ourselves. So it's Hope for Healing. This year will be on May 24th, but last year was so fun. We were able to have Drew Brees come and speak, and he was so wonderful. And the evening, I think everyone just wanted to be together. Everyone just wanted to be there. We had over 1,100 guests. We streamed it. We had hundreds streaming in. So just an incredible night to raise awareness, because you're right, Victory is and has been the best kept secret, which is not good for marketing. Like, we don't need to be a secret, we need to be known. And that opportunity was so wonderful. And this year is our 20th year. So for Hope for Healing, we're gonna be celebrating big on the stories of Victory, the partners, kind of the founders who were so critical in the beginning, how we have grown, and where we're growing too. We're not done yet. We still have a lot more, even throughout COVID. You would think that it'd be a time to scale back, but we grew with new programs for the clinic, new care for our patients, growing in nutrition and wellness, growing for surgeries, like a surgery fund for our patients. So new growth is coming, but there's still so much more that we need to do, and partners we need to bring closer together to truly accomplish wellness for our patients. So, but May 24th, mark it on your calendar.
I love it. I think it's fantastic. It will happen. No ifs, ands, or buts. And so I know that you guys have a program called Change Makers. Will you tell our viewers and listeners a little bit about that as well?
Absolutely. So the Changemaker campaign was started, oh gosh, years ago. And it was just an opportunity for the young professional, maybe the young family. They want to be involved, they want to donate, but maybe writing that $500 gift is not in the budget right now. But every gift truly makes a difference. So it's an opportunity for monthly giving to maybe pass on the coffee out, pass on the lunch out, and donate monthly $25 to $15. $50. We have a whole array of people who donate at different levels, but it's that collective impact model to where we all come together, we do our part, and big things happen. At Victory, for every $1 donated, we're able to stretch that 70 times. So you can just think, even a $25 monthly gift, and that multiplied every 12 months, multiplied with all the other change makers coming together, I mean, it can make a big impact. And those are dollars, those are operating dollars, which sometimes is not the shiny thing that a lot of people like to donate to, but it keeps our doctors in the rooms. It pays for our, our lights bills, which is not always exciting, but the necessary things to run Victory. So just critical, and truly makes such a difference.
That's incredible. And so I know one of the things that you guys do is when a patient comes in, and you touched on this earlier, when a patient comes in, say they have a cold or say they're having heart problems, y'all are able to, if you personally cannot help them in the office, you guys have a network of doctors, right? In and around the Mobile area, and I believe some in Mississippi as well, that you can send patients to. So tell us a little bit how that works.
And that's just the incredible thing about Victory is as Victory was started, these partners, these physicians, these specialists came forward and said, how can I help? We have a dental clinic. How can I help? I'll come on my Fridays off and I'll see patients, or I'll set up this room, I'll bring the equipment, and we'll start an optometry clinic. The specialists just build in their monthly schedules to where I'll come on the second, Monday of the month, schedule out my patients, and I'll be there, which is critical, because if you don't have primary care, you certainly don't have specialty, certainly don't have dental or mental health. And those are part of your wellness. I mean, those are the things that will put our patients in the hospital. They'll have worse outcomes, and actually uninsured patients, because they don't have that access to care, have a 40% greater chance of death from something that could be treated. So partnerships range from cardiology to orthopedic, dermatology, podiatry. Patients come in and they're identified with, some type of cancer, we can get them referred over to Mitchell Cancer Institute. We have a new partnership in Gulf Breeze at the Andrews Institute. And so we can refer, if a patient is coming, it's closer to Florida, we'll refer them over to see Dr. Chris O'Grady over there, one of the orthopedists. And Dr. O'Grady has worked with NASA. They worked with NFL for sports industries. And he's seeing our patients, which I love. Our patients should have access to excellent healthcare because they haven't. Dignity is such a big part of the clinic, restoring dignity to our patients, because that's a part of your wellness. So being able to refer patients to the best here in Mobile, to the best throughout the Gulf Coast, that's something that we're so thankful for, those partnerships, and that we're able to do. And new partnerships with the hospitals to get patients access to surgeries. So we started the William M. Lightfoot Surgical Patient Assistance Fund. It's in memory of our Dr. Lightfoot's brother, Dr. William Lightfoot. He was Dr. Lightfoot's first partner, not only his brother, but his first partner when they were surgeons at Providence. He passed last year. And so in his memory, and, just to honor him and his life, we started the surgery fund, to where for patients who either they need to have surgery, we have a surgery coming up that's truly life-saving for our patients, or just a truly restorative surgery for a patient's quality of life, we are able to assist with the funding of those, and also work with the hospitals. Like some of the surgeons will donate their time and their cost, and working with the hospitals to reduce that cost. But surgeries that really move a patient forward. Our first patient was a young man in his 20s. He had a traumatic eye injury, so he was blind in one eye, but he wants to get his CDL license. Well, you have to be able to see to pass the eyesight test, and he could not pass it. So we were able to get the surgery done, get his cataract fixed, get him some eyeglasses, and he emailed me, said, "Miss Kim, I passed my test. I'm off to prepare for getting a CDL license."
Nice.
And that's a life restored. That's income for him and his family. That's a young man who doesn't have to work, a $12 an hour job, that he can move forward. And we're so excited to see him do that. But it was just, he needed to have that surgery to do it. So lots of exciting things coming, but those partners really, they just mean the world to us and our patients.
How do people know if they, I guess, qualify to be to be served by you guys? Like, how does one know, like, hey, I'm a good candidate to work with y'all?
Right. So if they don't have insurance, that's kind of our big thing. The income range is broad. So a lot of people truly do qualify. So we serve 100 to 400% of the federal poverty guidelines, which sometimes it's like, well, what does that even mean?
Right.
But for a family of 4 or 5, the income can be, where you would think that would be an amount that would qualify for insurance. But because the cost of insurance is so high for many families, they still can't do it. And it might be that one parent can have the insurance, but the other can't, or that might not be insurance that they can afford. They can be paying it, but some are like, this is draining our resources. And they're having to make those hard decisions of, do I pay my utility bill or pick up my medication? So I always encourage people to reach out to our new patient services coordinator. You can check out our website, because probably most likely, if you're a small business owner, work for a small business, working part-time, you probably do qualify. So I always just have people to call, come in. We're appointment-based, just like any other doctor. We'll get you in to get set up as a patient. It's a just quick process just to get you all kind of just like you would in another doctor's office. And then we'll have you see the doctor.
So I know that Victory is a nonprofit, but I think what a lot of people in the community don't know is you're also a ministry. And so that is a huge part of what Victory is doing. And you've mentioned the word restore several times in this conversation. And I think that's a great way to segue into that part of what you guys do. You're helping to heal all aspects of someone's life, and you're going for the soul as well. So can you talk to us a little bit about the ministry side of Victory Health?
Mhm. Absolutely. Well, Victory was really born out of the foreign mission field. So our founders were doing overseas mission trips and serving thousands of people who came, and God just really put it on their hearts that they were needing to step out in faith and to serve the underserved. And what did that look like in Mobile? The sunshine right on me.
Dodge it.
I know, trying to find it. So that is really the why and the heart of why we show up to work each and every day. Yes, we love getting patients' diabetes under control and getting them on their blood pressure. I mean, that's blood pressure medicine. That's a part of their healthcare. But it's restoring lives. It's giving patients hope. It's sharing the gospel. It's sharing the good news of Jesus. And Victory, what I love about Victory so much is just such an authentic way that we get to live out our faith. There's not fluff. No one is forced. We see patients from all backgrounds, beliefs, just everybody is welcome to come in, and you will receive the same excellent health care, no matter what you believe, where you are in your faith, where you are in your life. We want our faith to come out in the excellence of the care, the compassion, the dignity, the restoration, and to truly care for the whole person. I know mental health is such a huge focus right now and is one of the top needs of our community. So that's a big part of what we do. We have free counseling for patients, and that's, again, taking care of the whole person. But I think when you integrate the healing of body, mind, heart, spirit, you're taking care of the whole patient. I think all of us saw during COVID just how stress and everything related within our life impacts our physical health. So if we address one without the other, then we're really not caring for our patient. But this is, for all of us here, it's certainly a calling, it's a mission, and just a way that we get to love on people.
I love it. You guys are doing some amazing things. So if a patient fits the qualifications that you talked about, do they literally just make a phone call? And what is the number that they can call? And is that the way they need to get set up to be able to be seen?
Yes, so they can call just our main number, 251-460-0999, and everything is on the website. Say, I'd like to become a new patient. We'll get them over to our new patient coordinator. We'll get them an appointment to come in. We can usually get patients in within the week, so there's not a long wait. If a patient, needs to be seen that day, if something's really going on, we'll make it happen and get them in. But we'll get them in and get them taken care of, and then we're just, like your doctor, when you get sick, when you need a refill, when you want to come see the dentist, want to see a GYN, optometrist for an eye appointment, we have that available. And if things come up to where you need to see a specialist, then we'll do the referrals. We can do lab testing. We do all of our labs here at the clinic. We do free EKGs. We do free x-rays. If other diagnostics like CAT scans, MRIs are needed, we have partnerships for that. Medication is a big thing. So we order and dispense all of our patients' medications here. Last year it was like 60 million worth of free medications we dispense. So it's just kind of a one-stop shop, which we're so thankful. I mean, Partners was put in our name because we knew we couldn't do it by ourselves. And, and I love what y'all do through the magazine, highlighting all of the nonprofits or the ones within the pages, because I mean, those are our partners too. We know Victory has our lane, but we will refer if someone comes in and they have a need that's kind of outside our scope. We're like, great, let's refer them over to this partner or this partner, and vice versa. We'll take care of, we see referrals from other nonprofits, and it's just, again, talking about that collective impact just in a different way. It's all of us staying in our lane and doing it well, not reduplicating services, but really partnering together to impact our community. So
Absolutely. And so one of the things that I wanted to mention as well is you guys were able to get sponsored by a doctor's office here in Mobile, the Park and Rebo Clinic. Whenever I was pitching this to them and letting them know that we are looking for sponsors, you guys were the highlight of their life, and they were so excited to be able to bring your write-up to the publication. So we want to thank them for that, definitely.
Yes.
Brooks has a question that he always likes to ask as we wrap up our conversations. I will let him.
Oh yeah, I do. But before I ask that, I'm gonna ask you one more thing. Is Victory help? It's almost like you guys are creating a blueprint for something that could work and happen across the US.
Yes.
Is that anything that you guys like? I would imagine that people have caught wind of this idea and maybe have even contacted y'all and said, "Hey, how do we do something like this or whatever?" Are there other organizations that you guys like network with or do similar things like this across the country?
Yes.
Or
So we're part of the Alabama Association of Free and Charitable Clinics. So there are some other clinics. Some are a little different. Some are completely free. Some are federally qualified clinics to where they get federal dollars. So we are not a FQHC. So we're supported primarily from just the community. So we don't receive a whole lot of federal dollars. Some are more reliant on federal dollars to come in, but we all partner together. But we have had clinics from throughout the Gulf Coast primarily reach out and say, "Hey, we see this model is working. It's efficient. Talk to us about it." But we're actually a duplication of a clinic in Memphis called the Church Health Center. So they are about, 35, 40 years into this, and have just grown and expanded. And they've been so gracious and generous with letting us glean all the wisdom from their best practices and learning. And that's really when Dr. Lightfoot and his wife Tammy were starting this. They went up to the Church Health Center, and that's where it was like crystal clear, like a fuzzy picture just came into clarity, and he said, "This is what we need to do." And then he brought it down to Mobile and made it fit for Mobile. But they replicate all throughout the nation. But this is going on all throughout. It's just such a efficient, effective model for healthcare. It's just doing healthcare. So whenever we have doctors come in, you don't have to do billing, you don't have to do insurance. We'll give you a paper chart, and you can just see a patient. And if you need to spend 20, 30 minutes with that patient, then that's what you do. So our doctors aren't on a timeline where they have to be in and out in 2 minutes and see this many patients. Of course, we want to see as many as we can, but we know we want to really, cover everything for our patients. And we might be the first doctor they've ever had. So we want to certainly take care of them. And sometimes that takes a little bit longer, and we love that.
Yeah.
It's a completely different model, totally focused on the patient and not focused on getting through I guess, what you have to go through whenever you're running a business as a doctor. So I think it's incredible.
A different model. Yeah. No, I love that. Okay. So the question is, is there a question that you don't get asked, but you wished that people would ask you about your organization, of something maybe that you'd want to enlighten people about? And if there's not, no big deal. But if there is, this is the opportunity to maybe, share that thing.
That's a good question. I think something,
that's my goal.
That's good.
That's a good
question. I think if you have always had insurance, it's not something that you think about. I've been very blessed, and I've never been in that position to have to really weigh, okay, do I need it? Do I not? What, I might need to give it up to pay this bill. So, what it truly means to not have insurance, I always try to put myself in someone else's shoes. So like when we're developing new programs, we're developing a prescription food box program and want to incorporate nutrition and movement and other things. So it's like, so for the single mom, what would this look like? Like, what is helpful? And it's not having her have classes to come into the clinic, but it'd be to stream and to do things, videos online, to where she can, after the kids go to sleep, she can do a quick video on how to get a 30-minute workout in, or recipes, or other tools. So I think for all of us to always think, well, how does that impact someone else's life? We had a cardiologist share at Hope for Healing last year, And he said, he's had times where he has a medication that can reduce, someone's chance of having a heart attack 25%, but they have to decide, do I go with that medication or do I pay my my light bill? Do I put, food on the table? And as, families, as parents, we're going to provide for our children first and foremost for their needs. But, I think to ask the question, what does it really mean to be without insurance and the repercussions? I think that's always a question that, I try to share just so that everyone can really see, like, it is a big deal. It's not just simply the checkups and everything, but over time, how those really can make a significant impact in, from quality of life, from, just how long, someone's life might be shortened just because they don't have access to a doctor. So how's
Yeah,
that?
absolutely.
That's good.
Well, to touch back on the prescriptions, it's something that you guys mention in the article is, you can go to the doctor and you can have, your checkup and you can be prescribed something. And then, like you said, it can be incredibly expensive. One of the things that you guys provide for your patients is, a lot of these companies, the drug manufacturers, they offer programs and they offer discounts, but y'all come in and actually do the work for the patient, correct? Y'all go in there and y'all are able to do it on behalf of them. So they are able to get those programs as well. And, I've seen the other side of that. They talk about it on the commercial. Oh, call see if you qualify for reduced. Sometimes you have to send in your W-2s and your tax information. I mean, it is a big deal. They don't just give out free medication. They put you through a rigmarole to get there. So one of the things that really jumped out at me in y'all's write-up is the fact that you guys are able to do that for these patients.
That's right. We have staff that is her entire job, and volunteers, because you're right. It's that little fine print at the end that says, if you need this medication, call. And they're required by the federal government to have that assistance for people without insurance or unable to afford those medications. If it's the generic medication, I mean, that's affordable, but the medications that cost thousands of dollars a month, I mean, there's no way that they can afford. And the requirements change every year. You have to re-enroll every year. It says original signatures from doctors. It's not like it's a stamp or there's really anything easy about it. And my office is actually right next door, and I hear her, going to bat for patients. But it's great that these programs are available, but it is certainly a process to attain them. We started a protocol for patients who are hepatitis C positive. So one of the medications we've been utilizing started off at being $100,000 per patient. And
goodness,
per patient. But it's a great medication. It's about a 12-week program. We can do all the labs. We get patients enrolled, but they get it for free, which is amazing. It literally saves their lives. We've had about 250 patients go through. All have been cured of their hepatitis C. So truly saving their lives. I think it's been reduced to about 70,000 per patient, but what
that's unattainable for at all incomes.
The majority.
Yeah,
exactly.
That's insane.
Exactly. So that's just one of the successes, but every time we can get a patient a medication, is a success. We have many patients who struggle with diabetes, heart disease. We have refrigerators full of insulin that we can give to them. And keep them healthy and well, educate them on the importance of taking their medications as prescribed. Because a lot of patients come in and they'll say, well, I took my heart, disease or whatever is going on every third day instead of every day to like stretch it out. Or I've been out for months. It's like, let's get you back on. We'll get you taken care of. So that again, it's those questions. Do I take my medication as prescribed, or do I stretch it out so it'll last longer?
Absolutely. Well, go ahead.
No, go ahead.
As we wrap up, I just wanted to give you the opportunity to let the public know, anybody who might be listening to this or watching, what is one way that they can help if they're not necessarily qualified to be a patient. What is one way that they can help, and how can they contact you? I know you said the number again, but I'll give you the opportunity to say the number and the website again.
Yes, absolutely. Well, we all know somebody who can be a patient. It's usually someone in our family, friends, coworkers. If you're a small business owner, just letting us come share with employees, share information. I'm going to go speak to a cleaning company or actually hop on a Zoom call to share with a cleaning company's employees just about Victory so that our workforce can be healthy and well. So supporting our small businesses so that their employees can come to work healthy. So being an advocate, being an ambassador for us so that we aren't the best kept secret, so that Victory can be a household name. So if someone thinks, even if it's for a time frame, a 6-month time where they don't have insurance, come see us. We'll get you taken care of. So being ambassadors, we have volunteer opportunities. You do not need to have an MD behind your name, but we always need help, whether it's up in the front office, helping with events, calling patients, getting patients set up with their medications. And then, of course, we also, for people who are medical, who would want to come volunteer, we would love to have them. And then always support. We always need it to be able to do what we need to do. And as we continue to grow, the need always arises. But the direct number for the clinic is the 251-460-0999, victoryhealth.org. We're on social media. Follow us. And if people are interested, there's something about coming in and seeing Victory, seeing the practice in action. If people want to come in for a tour to see, our doors are always open.
I love it. Fantastic. Can you throw out the address real quick too?
Yes, we're off of Airport Boulevard in downtown, or kind of close to the Heron Chandler YMCA, but we're 3750 Professional Parkway.
Fantastic. Thank you so much for giving us your time this morning and to share all of the information. Yeah, absolutely. We are so excited that you guys are part of Do Some Good this year, and just can't wait to be able to share this with our community.
Awesome. Thank y'all for everything that y'all do.
Thank you. Keep up the great work. We'll talk to you soon, Kim.
Will do. Take care.
All right, see ya.
Right.
Bye-bye.
Bye.
That was great.
That was great.
Everything. Kim's awesome. They're awesome. Victory
Kim's
Health
amazing.
Partner.
I'm super excited that we got to chat with her today. It's always, every time we speak to a nonprofit, I am always just overwhelmed with all that they are doing. They are really making some major changes in our community. So I just want to thank Victory Health Partners for doing all that they are doing and continuing to grow.
There's a lot on their plate. There's a lot of nonprofits plate. I'm just now thinking, I want to keep this thing growing. Like, we want more nonprofits that if they weren't involved this year, we want to figure out how to get them involved in the future, how to get them a sponsor so that they can be in the publication and be a part of this thing. Cause we obviously want to highlight everyone. It's just, it's a giant project that, has a huge cost to produce it. And I'm so excited.
Yeah.
They do an awesome job. Well, guys, thanks for being with us. Thanks for listening. And keep listening, because we've got a whole lot more coming out. See ya.